The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. Welcome to Pediatric Perspectives, where we are looking at children's health challenges from a different perspective, one that includes critical thinking, one that's not afraid to give you the honest truth. My guest today is Dr. Ben Lynch. You are probably my favorite naturopath, and you are certainly doctors are supposed to be educators, right? We're teachers, and you are the best teacher I know, a teacher of doctors. I remember going to your conferences, and man, did you know the biochemistry. For those of you who don't know Dr. Ben Lynch, he is a biochemistry nerd. He knows more about pathways than I think anybody on the planet. You are the author of Dirty Genes. You're the founder of the incredible supplement company Seeking Health. And we could go on and on, but I want to get into our topic today, which is going to be folic acid, acetaminophen, and vaccines during pregnancy, the perfect storm on neurodevelopment. Let's just dive in. I wanted to start with folic acid and maybe just help us understand the difference between natural folate, folinic acid, and how this all relates to pregnancy.
Yeah, great question, Paul. And I hear you. There's a myriad of things that are affecting our kids, and these three are a big one. So starting with folic acid. So we hear about folic acid, and we think folic acid is the type that we need based upon all the things that you hear and read and hear from your doctors and published literature, et cetera, and you back of your supplement bottle, your prenatals. I want to inform you that folic acid does not exist on the planet. It is absolutely created by humans in a lab for the sole purpose of putting a synthetic folic acid back into food where its natural folate used to be. So folate on the other side does exist in nature. Folate, the term itself, is derived from the word folar, which comes from leaf. So foliage, folate. And so you have natural folates found in foliage, and you have methylfolate, you have tetrahydrofolate, you have dihydrofolate. There's hundreds of different types of varieties of folate. And the body will primarily use one type of folate called methylfolate, which is very, very supportive of a critical process during pregnancy called methylation. And if you look at the structure of folic acid and methylfolate, they look absolutely identical, except for there is one carbon and 3 hydrogens missing.
One methyl group.
And to put that carbon and 3 hydrogens back on requires multiple enzymes in the human in order to do that. And newborns and infants can't do it. They literally can't do it.
Regardless of their genetic SNPs like the MTHFR.
Regardless. So I just refreshed my science understanding this morning, and to make sure I'm accurate, and I sent you the papers and the information as well. So you have it for reference. So as we know, holding a newborn baby is a celebratory moment. I mean, the moment I held my son for the first time was amazing. I changed from just a guy to a dad.
Yeah.
And that was tremendous. And we celebrate that. The problem is we think the babies are ready and we're done. They survived pregnancy, but their livers and their intestines are very, very immature. And in order to process folic acid, you require healthy liver enzymes and liver function. And infants and newborns literally don't have the ability to do that. So they are 100% dependent upon the mother during gestation, during pregnancy, and during breastfeeding, or during infant formula feeding to get access to real folates, methylated folates, so they can grow. And the problem is pregnant mothers are typically given folic acid. So that gets into the baby. And nursing mothers are giving breast milk to their baby. Also, the babies are receiving folic acid. And the baby has no ability to remember. Folic acid has to be biologically transformed into active folates in the human body. And it can't in newborns and infants. It just can't.
Period.
So,
So help me understand, because I was aware of the difference between folic acid, which is synthetic, and methylfolate, which is the active form of folate. When a mom is pregnant, if she's eating lots of green leafy vegetables, that's still not methylated folate, is it?
you can have methylated folate found in food, especially liver. So liver has the highest amount of methylfolate in it. You're
Okay.
correct. From my understanding, you are getting more dihydrofolates and tetrahydrofolates from leafy green vegetables, which then have to be converted.
Right. And
However,
so,
humans have been on this planet for a long, 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 long time,
right.
right? And we decided to enrich foods with folic acid in the late 1980s, and autism has started coming to rise. Now, let me give something that will make it clear for a lot of people. We know about leucovorin and autism. We've heard about it from Maha and President Trump and Secretary Kennedy.
Right, which is high dose methylfolate, right?
High dose folinic acid.
Folinic acid, sorry, yes.
Yeah, folinic acid. And folinic acid still has to be converted to methylfolate, but folinic acid is biologically available for the brain. If you look up the condition called cerebral folate deficiency, folic acid is contraindicated, which means folic acid cannot, should not, absolutely must be avoided for people with cerebral folate deficiency.
Mm-hmm.
If you think about what is cerebral folate deficiency is the brain is not getting sufficient active forms of folate. Folic acid is not an active form of folate. If you have a brain deficiency of folate, and folic acid is contraindicated in this condition, and infants and newborn babies and 1 to 2 year olds cannot convert folic acid into active forms of folate, such as folinic acid or leucovorin or methylfolate,
Right.
then you need to ask yourself, well, all infants are now cerebral folate deficient, 100%.
And in the womb, right?
And in the womb. If
Yeah.
the mother is taking folic acid or is eating processed foods which contain folic acid, or she is deficient in methylfolate or folinic acid. So this goes way beyond MTHFR SNPs, way beyond.
Yeah. Excellent point. So it is tragic, in my opinion, and I think you feel the same way, having been an expert in this area and started a supplement company to try to help people. First of all, flour is enriched with folate, right? They strip
With folic acid.
Yeah, they supplement synthetic. So
Yes.
if you're eating processed foods, anything made with flour, even if you're baking your own, if you're using enriched white flour, you are harming the unborn child or putting them certainly at risk.
Yeah, and I think that's why partially so many people are doing better with the carnivore diet or the animal-based diet. Because if you're on an animal-based diet, you are essentially eliminating all folic acid.
The kind that is not tolerated by babies
Humans.
developing in the womb, infants,
Yeah.
that kind of, yeah.
Yeah, and let's expand this a little bit more. Folic acid is man-made. Folinic acid, leucovorin, methylfolate are physiologically available in the human body, readily used. Folic acid has to be processed by active enzymes in the body. Newborn babies, developing babies, and infants and toddlers do not have the ability to process it, convert folic acid into active forms. Folic acid is contraindicated in cerebral folate deficiency. Now, folic acid, you look at all the research and it's like, well, it's lowering neural tube defects across the planet. Well, Paul, I sent you and your team a massive meta-analysis that says, well, neural tube defects were actually declining in the population regardless of folic acid introduction anyway. So is folic acid actually lowering the neural tube defects, or were they just declining because of increased socioeconomic norms in the population? So the other major problem with folic acid is it is very well absorbed. Now, we all know that you should not be sitting in a garage with your car running. And why is that, Paul?
Carbon monoxide.
Okay, what happens with carbon monoxide?
Fill us in.
Okay, so carbon monoxide binds to your hemoglobin preferentially over oxygen. So you have, let's say, 4 docking sites on your hemoglobin. And out of 4 docking sites, you want to saturate that with oxygen. As you breathe in car exhaust, you are inhaling carbon monoxide. And carbon monoxide, I believe, guessing here, has a 600 times stronger binding affinity to binding to hemoglobin over oxygen. So you are blocking your ability to bind oxygen, even though you are inhaling it. You have it, but you also have more carbon monoxide. So even though you have oxygen in your body and in the car, you cannot bind it and you can't deliver it to your tissues. Folic acid is the exact same. Folic acid is very well absorbed. It binds to what's called folate binding proteins in the body better than folinic acid, leucovorin, or methylfolate. It binds to the receptors in your brain better than leucovorin, folinic acid, or methylfolate. So you have what's called a functional folate deficiency. You have all the folate in your body, potentially, but if you have folic acid, you are now functionally folate deficient and you have a cerebral folate deficiency in the presence of sufficient, adequate folate, which is why they use massive amounts of leucovorin to try to bull rush and overwhelm the amount of folic acid that is inside the bloodstream of these children with autism or cerebral folate deficiency issues.
Wow. That is a great analogy. So if I'm getting this right, if I'm pregnant or about to be pregnant, I want to make sure I am not ingesting synthetic folic acid anywhere. So I don't want to eat flour that's enriched with folate. I don't want to take supplements that have folate or even folic acid. I have to take supplements, and I know you've done a great job of creating a prenatal that has the right kind of methylfolate, folinic acid in it, right? But we don't want to take synthetic folate, correct?
Correct, 100%. And the issue is the conventional recommendations, the CDC, the American College of Medical Geneticists, obstetrician, gynecologists, they all say, regardless if you have MTHFR or not, you should take folic acid. If you have recurrent miscarriage or infertility, then you need to actually increase your folic acid from the suggested 600, 800 micrograms of folic acid up to 4 to 5 milligrams, excuse me, of folic acid. And that's going to make things even worse. And
How did they get it so wrong?
I don't know, Paul. I don't know. I think it goes back to how these research papers were created. And in these large meta-analyses, there was no really placebo-controlled trial. There was no evaluation, or not sufficient enough. And so the studies were underpowered in this massive meta-analysis. They were poorly done. The folic acid in the research is very, very well absorbed, 100%. Now, there are some people that can convert folic acid into active forms of folate. But the problem is there's this enzyme that's called actually DHFR, dihydrofolate reductase, that nobody talks about. And most of the research on folic acid was done on rats because rats are very close to humans, generally speaking, in terms of genetics. And so rats and mice can process folic acid very, very fast, 800 times faster than humans. But the problem is the human dihydrofolate reductase enzyme, the human DHFR enzyme, not MTHFR, DHFR, only has a capacity of 100 micrograms at a time. So if you are taking your prenatal, you're getting 600 to 800. If you've had recurrent miscarriage, you're taking 4 to 5 milligrams of folic acid. So you are overwhelming your ability for DHFR to convert synthetic folic acid into something that's biologically available. And through no fault of your own, because you've been misinformed, and I have not been loud enough on this issue, you are actually causing cerebral folate deficiency in your developing baby, your newborn child, and then you vaccinate your child, or potentially you take acetaminophen while you're pregnant because you got a fever and you're concerned about fever in your child's development. So you take acetaminophen to lower the fever based upon your doctor's information. And then you, based upon your doctor's information again, you bring your child in to protect it and support it, and you vaccinate it. And now it's a perfect storm.
Wow. I want to touch a little more on acetaminophen and vaccines, but before we do that, so that we have our audience really understanding what to do with regards to folate. If you're advising somebody that's pregnant or about to be pregnant, tell them how to do this correctly.
Okay. It's actually pretty easy. So first, take a big breath and relax and just remove all the genetic crap out of your head. Okay. It's very simple. Eat a diet that is of real food. Walk the perimeter of the store. You got your eggs, your cheeses, your fruit, your vegetables, and your meat and your dairy products. Dairy products, that's another issue, but we'll touch on that later. But animal-based diet, I believe, is a great one. And I like animal-based with fruit. You know, Dr. Paul Saladino does a great job with this. He's a good friend of mine. He's pretty extreme. If you want to eat vegetables, go for it. As long as you do well with that. And then look for a prenatal that either has calcium folate, folinic acid, and then some methylfolate. I do prefer prenatal vitamins that have folinic acid and methylfolate. Some women do not tolerate methylfolate because it's like jet fuel. It can really make you feel anxious, irritable, having joint pain, difficulty sleeping. And so if you're taking a prenatal that has methylfolate and you are experiencing anxiety, irritability, headaches, migraines, difficulty falling asleep, joint pain, then I urge you to stop taking that prenatal and switch to a prenatal that has 100% of calcium folate or folinic acid instead. And you'll be way more tolerant and actually should feel good. And I don't know the reasons why methylfolate is doing this in a lot of people, but it's why I actually designed prenatals that have folinic acid in them instead. A lot of people focus on miscarriage only on the woman. It can be a selective process by the body. And so if a woman is pregnant and the chromosomes that she's received from the man are not very strong or robust, she will abort the baby. She'll miscarry the baby. And she will feel at blame and what's wrong with me, but it actually could be the fault of the unhealthy chromosomes brought in, which fertilized her egg. And so you need to support healthy chromosomes in the man, ideally 3 months prior to conception, because it takes about 90 days for a healthy sperm to completely renew and regenerate.
I don't quite understand how that would work. Can you explain it to me? If I'm a man, I want to have a child, or maybe we've been trying and we're not being successful, and it might be due to the chromosomes that I'm sending off in the sperm. How does taking a supplement change chromosomes?
Because sperm is the carrier for chromosomes. And you can have what's called DNA fragmentation. You can have high oxidative stress, which is like free radicals, which you hear about. And so if sperm are carrying, sperm are made in advance. And so they are sitting in the storage area in the man prior to being ejaculated, and then they go and do their job. So if they are in the storage area and they don't have sufficient nutrients, or they're exposed to high oxidation environments or free radicals, then the chromosomes that should be intact and healthy aren't.
Okay. Sort of the same concept we have with, very elderly fathers. That sperm may have had more time to be damaged.
Yeah, the older men are, and just like women, the older her eggs are, because the eggs, there's a great book, I forget the author's name, starts with the egg. Great book for women to read as well. And then Real Food for Pregnancy by Lily Nichols, another great book to read.
Let's wrap up by covering the perfect storm that so many unfortunate babies in the womb are having to experience. and you touched on it, but talk a little more about acetaminophen and then vaccines in pregnancy.
Yeah. Okay.
Why is it not a good idea is my guess is what you're going to say.
Exactly. So let's hit acetaminophen or paracetamol. I believe you say that in London, you UK folks, or Tylenol. So Tylenol is taken during pregnancy, oftentimes for to reduce fever, to reduce the risk of damage to the baby, because high fever, and I don't know the sweet spot, of what fevers are okay and which aren't. Maybe Paul knows, but Tylenol is often taken for those reasons. And Tylenol is processed by enzymes in the human body, the woman, and when it's processed, it releases a compound that is pretty toxic. And to neutralize that toxic compound, there's an antioxidant that needs to be present in the woman. So the more you take acetaminophen, the more free radicals you make, the more oxidative stress you create. And if you have low antioxidant levels, specifically low glutathione, which is your body's primary antioxidant, then by you taking acetaminophen, you are reducing your glutathione levels overall, which then also reduces the baby's glutathione levels, because everything that happens in your body is happening to the baby's body. A good friend and colleague of mine, Dr. David Berger, practices in Florida. This is a great story that clarifies a lot of things. He specializes in autism, and he was meeting with a mother, and he was going over the child's labs and seeing how they can support the child with autism. And so he's saying, okay, look, you can see the glutathione level here is low, this is low, and this is low. And the mom goes, Doc, those are my labs, not my kids. And he says he's seen that over and over and over and over again. The labs of the mother are very similar to the lab of the child with autism. And so it does begin in the womb. And so if you are taking Tylenol or acetaminophen, you are lowering glutathione levels, and lower glutathione levels are associated with increased risk of autism. And you get lower glutathione levels from not eating an animal-based diet, from being exposed to other chemicals in the environment, such as formaldehyde, chlorine, swimming in pools, hot tubs, drinking unfiltered water, because chlorine actually is processed by glutathione. Formaldehyde that can be in new cabinets, carpets, new clothes, working department stores, that is also requires glutathione. So it's your body's most important, and acetaminophen depletes it. And so it's not that Tylenol or acetaminophen cause autism, it reduces your ability to neutralize a lot of harmful chemicals in your body that you are breathing every single day. You breathe 11,000 liters of air every single day, which can be full of formaldehyde, chlorine, and you need that glutathione on board. Otherwise, you are overwhelming your developing baby or your newborn child with that, and they don't have sufficient glutathione levels. And then you vaccinate them, and glutathione is needed for healthy immune modulation.
Yeah, acetaminophen, Tylenol, paracetamol, all that compound absolutely shuts down glutathione, right? People don't realize that the therapeutic dose of Tylenol is very close to the toxic dose. So unfortunately, that medicine is really dangerous even at therapeutic levels. And if you are overdosed with Tylenol, you are given Mucomist IV in the emergency room in the hospital, which is basically NAC, N-acetylcysteine. Can pregnant moms take NAC?
They can. They can take NAC, and they can also take glutathione. And you usually see this take in the research that says high-risk pregnancies. And I understand we don't want to be doing studies on pregnant women. I get that. And I'm not a fan of high-dose NAC or high-dose glutathione. In fact, anything high-dose during pregnancy, because even a hug is as nice as a hug is. You get a hug that's too strong for too long. You're like, dude, let go. I'm good. So anything in excess or too much, it can be a problem. I'm a fan of using low-dose glutathione or low amounts of N-acetylcysteine. One problem I want to say about N-acetylcysteine, it's a mucolytic, which means it breaks mucus, which means it can dry you out. And I was a huge fan of N-acetylcysteine. I still am, but I was taking it every single day. I was probably taking a gram every single day. You usually find N-acetylcysteine in 500 milligram capsules. And I started having, unbeknownst to me, this was me because of me taking N-acetylcysteine, constant nosebleeds, very dry eyes, constipation, very dry skin. And then one day I was like, what? Okay, I just stopped, because every single day in the shower, I would have a nosebleed every day.
Wow.
And I was like, okay,
And
this
just
is
stopping
dumb.
the NAC solved that.
Yeah. I was like,
That's fascinating.
yeah. I was like, why am I doing this? What's going on? And I was like, what changed? And so then I eliminated NAC, and like a week later or so, my nosebleed stopped. My dry
Wow.
eyes were getting better.
So let's wrap this up. We've covered the folate and what kind to take and what to avoid. And clearly we want to avoid acetaminophen. I mean, my whole practice, I was telling people, get it out of your house. It just has no business for any purpose, really. And especially during pregnancy. What about the vaccines? What can you say about vaccines during pregnancy? I mean, we've gone from a generation or two ago, all OBGYNs would say, absolutely do not vaccinate during pregnancy. This is a crucial time, a sacred time. Now we've got the Tdap, I mean, the DTaP, the flu shot, the RSV, the COVID. What can you say about that?
Yeah. Huh. Well, I will say that pregnancy is a time of protection, and even the mother's immune system knows this. When a woman is just going about and she's not pregnant, her immune system is, not on high alert, but it's more alert and more reactive to breathing in bacteria and viruses, and it's more likely to amplify her immune system to override those bacteria infections and viruses and molds or what have you. When she's pregnant, she has what's more called immune tolerance. And so pregnancy shifts the immune system from being on more alert to becoming calmer, even if she inhales a virus or bacteria. And so she is actually more likely to get somewhat sick during pregnancy, but she has to do that. Her immune system has to do that because the immune system would otherwise abort the baby. It would kill the baby because it's a foreign object. And so when you are injecting a vaccine during pregnancy, which is when the immune system is supposed to be naturally calmer, the very nature of a vaccine has adjuvants, which are known to actually amplify the immune system. And so that, to me, doesn't make any sense. Why would we ramp up the mother's immune system during pregnancy when it is biologically, physiologically designed to have a calm immune system? And so if you are wondering how to protect your developing baby, I would say take a very good prenatal, get out in the sunshine, and take sufficient vitamin D, get sufficient zinc, selenium, vitamin C, et cetera, for supporting a healthy immune system. And you're going to be good, generally speaking.
You've shared some, and I've read studies showing increase in miscarriage,
Yes.
increase in premature delivery associated with vaccines, right?
Yes. Yes.
Yeah.
And it's very hard to find that information. Unfortunately, National Library of Medicine is very filtered. I really enjoy open evidence AI tool, but I find that it thinks a certain way.
Yeah.
Yeah.
Yeah. It's not quite uncensored as we would think.
No, it's not. And that's why I really appreciate, Secretary Kennedy and President Trump and the team at Maha and yourself and, all these people pushing to get the information out to people. And people are waking up and taking power in their own decisions, in their own life, with their own families and their own friends. And it's amplifying, and it's really working. And I'm really excited to be part of it.
Well, thank you for all that you're doing to help. And thank you for this information today, which should help a lot of moms. Every mom on the planet, or soon to be mom, should listen to this show, take notes, and follow what you're saying. It's priceless. We will provide references in the show notes. As you wrap it up, though, unfortunately we've run out of time. What are the alternatives? Let's just say I'm a pregnant mom. Obviously I'm a guy, but as a couple, we're deciding, this idea of vaccinating during pregnancy just seems too risky, doesn't make sense based on everything you've just shared. What are the alternatives we have if we choose not to vaccinate?
I mean, in terms of what? In terms of just protecting your baby, or?
Yeah, having a healthy baby. And I guess, why would people vaccinate anyway? I guess you're vaccinating because you don't want to get sick.
Yeah, you're vaccinated. For me, a vaccination is designed to, the idea of a vaccine is a good one. The idea of a vaccine is to introduce a little bit of a problem compound that your immune system will recognize. In the event that you do get exposed to that problem issue at some point, your immune system will readily see it and be able to mount an immune response to it, and you'll be able to neutralize it. The problem is, and I'm not going to get into it, it's too strong, too powerful, and not studied enough. So I would say, if the whole idea is to prepare your immune system for an insult, well, let's prepare your immune system for an insult. And you do that by nutrition, healthy sleep, healthy stress levels, healthy amounts of exercise. Too little of exercise hurts your immune system. Too much of exercise hurts your immune system. Moderate amount of exercise is perfect for your immune system, actually raises it a little bit. So go for walks, and after meals, etc. Don't do high endurance trainings, especially pregnant women. Exercise, but don't go too nuts. Sleep is very important for immunity. Nutrients, very important for immunity. Too much sugar will depress your immunity. Too much stress, physical and emotional stress, will depress your immunity. So be mindful of these things. And, vaccines, it's such a belief structure that if you don't vaccinate your kid, you are an anti-vaxxer and you are harming your child. Well, you are still, seeking information that is out there to support your baby in the best of your ability. And so I would not, it's easy for me to say because I've been labeled an anti-vaxxer and I don't care, what people call me. So I would just say, you're doing the best that you can for you and your family, and you're making decisions based upon the evidence that you are receiving. And if you choose to vaccinate, choose to vaccinate. If you choose to support other alternative methods and you have evidence to back that up, choose that route. There's no right or wrong if it's your belief. I have the belief, and from my research and talking with Dr. Paul, is an expert also in vaccines, and I've read his books, fantastic, that I choose not to vaccinate my kids or myself. Re-listen to this interview again and take one thing and apply it. Just one thing and apply it. And usually stopping something rather than adding something is the ticket. So if you are ingesting folic acid, stop taking it. Even if your doctor or your OBGYN or someone else is saying you really need to do it, then I would actually fire that doctor, stop seeing them, and find someone who actually will support you in your journey using natural forms of folate, because they are out there.
Wonderful advice. Thanks again for being on the show.
Thank you, Paul.
It's always a pleasure to have you on the show. I look forward to seeing you next week. You can find me at kidsfirstforever.com if you want coaching or more information, and have a blessed week.
Can you tell us your name, please?
I'm Brooke Davis.
And who's this? Who are you?
I'm Lily.
How old are you, Lily?
I'm 8.
8 years old. All right, fantastic. So go back. Let's talk about your interview. Talk us through it.
Okay, so should I start when I was little?
Sure.
Okay.
As early as it goes.
Okay. We grew up pro-vax because that was just the normal thing to do, like everyone else did. And I actually brought my medical records. I was going to show you guys that I had. When I was little, I think the vaccine schedule, I was born in '84, and I think it was 12 vaccines until I was 18. And I still had inner ear infections all the time, and
Do you know what those vaccines were back in that day?
I have, they're all on here. Sure.
So DPT, which is now off the market because it's so ghastly, and you also had polio, rubella, mumps, and instead of MMR, TBC, and flu vaccine. All right.
Yeah, all the good ones. And then you'll see right here, it says amoxicillin rash ? So it says that on a lot of them. I had natural chicken pox. They didn't have that vaccine yet.
How do you remember having chickenpox?
I remember it.
How was it?
I had it for a week. I think I actually had it for 4 days. And I had a rash, and we did the calamine lotion, and it wasn't super fun. I had a fever, but I was fine. I just played with my Barbies the whole time and, watched my shows and stuff. It was itchy, and I just had to take the baths with the oatmeal baths and stuff.
But we'll take itchy over brain injury or death, won't we?
Yeah, I'd take that over that any day. And I actually have a story I'll tell you about that later too. But anyway, yeah, in my records here, it says that I had inner ear infections right here. It's this one. I kind of got this together quickly before we left. I wasn't super prepared today, but right here, bilateral middle ear effusions, I guess, and the dates, bronchitis. I was always getting sick afterwards, and there's all my shots when I was little. So it made me, instead of making me healthy, it made me really unhealthy. And fast forward to when she was born, every time I would take her to the pediatrician, it was a regular pediatrician that we started with. We go to a holistic doctor now, but we would go, and then I would decline the vaccines, and they would want me to sign off on it, saying that I was potentially putting her in harm's way and things like that, when I know it's the opposite. But we would come back sick from the wellness visits sometimes with, the flu once, like a couple days after going there, just because I'm sure that, there's lots of sick kids there all the time, which is sad. But anyway, we switched to a holistic doctor later because of that. And a little bit about my story more. So I did all this when I was little and had, all the ear infections and everything. And then later on in life, I worked at a veterinary hospital, a couple of them. And the first one that I worked at, I was bit by a feral cat that was waking up from surgery. And I was pulling her intubation tube out, and she wasn't awake yet, but then when I pulled it out, she woke up really quick and bit me. And so I went to the workman's comp doctor, and I actually requested to get the tetanus vaccine because I hadn't had it in a while. And so they ended up giving me the combo Tdap vaccine, which I didn't know that it was a combo until after I took it. They gave me the brochure afterwards, not before. And they also gave me an antibiotic to take in case of infection. And right when I got the brochure, I looked at it and I realized it was a combination vaccine, and I was like, I don't remember taking a combination tetanus vaccine the last time.
Are you sure it was DTaP and not Tdap?
It was probably Tdap.
Okay.
Yeah.
misled with the title of this. I apologise to our viewers. Yeah, it would have been TDAP.
It was probably
yeah.
TDAP. I think it's DTAP if you're a child.
Sorry,
Yeah, sorry about that.
No, it's my fault. It's not.
Kind of, I think it's the same thing.
Yeah.
I think it's the same dose actually. But anyway, so I took that, I got the brochure, and I was kind of upset that it was a combo and they didn't tell me. And I went to the parking lot and I immediately didn't feel well, and I was sitting in my car and I thought, oh, arm pain, that's normal. And then as a few years went on, over time I was starting to get really bad asthma. And I ended up going to several different doctors, and I had MRIs, trying to figure out what was going on with my tingling in my fingertips and my toes and my numbness and my brain fog and all of my symptoms, my inflammation symptoms that I was having. And no one could tell me what was wrong. They just wanted to give me medication. I took Singulair for my asthma, and I had a reaction to that. I had a big kind of TMI, but blood blister on my foot after taking it. And they just told me that they would add it to my list of reactions. And so I got kind of frustrated and wanted to figure out why I was so sick. And I was working, and at the time I was working at a new vet, and not feeling well all the time. And I would get like these pains in my head too, these zings that just, and headaches and things like that. So I ended up going to a holistic doctor, and he did some other testing on me, functional medicine testing and things like that. And I ended up having candida, which is yeast in your bloodstream, and it causes all kinds of problems. And when I looked up, after learning that it was a vaccine reaction probably that was causing all this stuff, and since I wasn't feeling well since I took it, that it was probably that caused it. And I looked up the ingredients, and it had a yeast protein in it, and they inject it right into your bloodstream. So I'm pretty sure that was the source of that. And I'm doing a little bit better, but I have vision problems with my right eye sometimes, and also arthritis now, which after a lot of research on candida and dealing with it, I've learned that candida leads to MS sometimes, if it's untreated. So I ended up deciding not to vaccinate my daughter, because it happened in 2011 and she was born in 2015, and I was learning all this stuff. So, and she has never had any disease or anything. She did have COVID. I had COVID.
How did you treat that?
I was really sick with it, and I was in bed for a couple weeks straight, and then my aunt actually made me the quinine recipe with the grapefruit and the lemons and orange peel, and I took that, and that's actually how I healed, and nothing else worked. I tried all the stuff, echinacea, colloidal, I always call it colloidal silver. It's colloidal silver, I always say that. But I tried all the things, nothing worked this time, and they always work with every sickness usually. And that was the only thing that worked. So that was what helped me, and a lot of prayer too.
So you have had no vaccinations?
Just vitamin K. That was the only one I did, which I regret. Yeah, but
All right, so how do you feel? You feel healthy?
how do you feel?
Do you have autism?
No.
Are you paralyzed anywhere?
No.
Do you have seizures?
No.
So you're healthy.
What?
You're healthy. What do you want to be when you grow up?
Artist.
Nice. We need good, healthy artists. That's good. Well, you can thank your mum. It's one of the best gifts you can be given. No vaccinations for sure.
Yeah, it's been a battle here in California with choosing that. It was right around the time that the governor signed the law where she can't go to school, Newsom, where she couldn't go to school if she had, unless she had every vaccination. So we homeschool. We have her whole life. And I'd say she's advanced in learning. And she did have COVID for, I think, a few days. And then she was fine.
2 days, I think.
Yeah, and then she was fine.
So someone's asking a question, asking if you got bit by a cat, why didn't you have a rabies shot and not a tetanus shot?
Well, I don't know.
Well, I can answer that. I think I got bitten by a vole once.
What?
A vole. It's
A
just
vole?
Like a
It's like a
wild
little
mousy thing.
Yeah,
And
I know
they
what it is
gave
now.
me a tetanus shot.
Okay.
Because it breaks the skin. And they said that you're going to die. If you don't get it.
Rabies, that's probably one of the most misunderstood things, like they all are. But rabies, there hasn't been a rabies case I've done my research. There hasn't been a rabies case in California since 2012, and it was by a bat biting someone. And then the last one was in the 70s, but they require every animal to get a rabies vaccine by law still, even though there aren't any California, even though there aren't any cases like almost ever. And that, working at the vet, I did see cancer happen at the injection site, which was really sad. It was a puppy. Came back with a tumor right after the vaccine, and then we had to pay for, not we, but they had to pay for all of the treatment after that. And so and you would know if an animal had rabies immediately. They present with neurological symptoms and they can't stand or anything like that. So I think, so the doctor, when I had the Tdap, I guess, he actually kind of like shrugged when I said that when I was kind of insistent on getting it. So I think maybe he knew that, first of all, you don't take it after you have something happen to you, because that doesn't make any sense. You take it before so you can build up immunity.
Well, that's the theory, anyhow.
Right.
So would anything make you guys ever have another vaccination or so?
No, not at all. So even if they cleaned them up, I still wouldn't trust it.
Absolutely.
No, because, they've kind of broken the trust with that one.
Well, it's lovely to see you. Thank you for doing this interview.
Yes, thank you.